So back to the story. Um, Once it started, the bleeding started. Um, it became nonstop. I can say it didn't stop. I ended up having going and get my eye surgery in December. So mind you, DNC was the end of November. I had my eye surgery December 12th. My first left eye surgery. I was still bleeding. Um, December 19th, I ended up going into the ER because I lost so much blood. And because I was losing so much blood, my iron was depleting drastically to the point that my migraines were inflamed. I didn't have blurry vision because, of course, that was the eye surgery. That had something else. But everything else, I just couldn't focus. I couldn't, it was just nonstop. Um, I went to the hospital. They asked me to give them a urine sample. I came back with a whole container full of just blood. They was like, "What is this?" I'm like, you said for a urine sample. This is my urine sample." They said, "Urine sample?" I said, "That's not urine. That's blood." I said, "Yeah, exactly. This is why I'm here." I had emailed my doctor to see what I needed to do. The nurse called me and told me and recommended me to go to ER. My doctor, unfortunately, she wasn't really paying attention. That's another thing too. When you go to these doctors, you have to make sure that they're paying attention to what's going on with you, because they have so many patients and they totally forget who they're talking to. So mind you, this same doctor, she told me that I'm allergic to iron. But yet, when I'm telling her that what was going on and how I got to the ER, she recommended for me to take more iron pills. Of course, I didn't listen to her because I'm like, yeah, you did not read my chart. Wrong patient. Sorry. I'm not going to listen to you. Well, what she did, she prescribed some medication that stopped my bleeding. I had to take it for 10 days. It finally stopped my bleeding. And then 3 days later, after the bleeding finally stopped, it started again. So I was right back to the same square one. I went back to her again because I had to do a follow up. At the follow up, she was like, "Well, I guess it didn't work. So what else? What's next?" I'm like, "What do you mean what's next? You tell me." Again, I'm not going on birth control pills. So please give me a better option, because you're giving me a band-aid to something that is what. So she said, "Okay, fine. Then I guess we're gonna have to do a hysterectomy." She was like, "Okay, we're just gonna do a regular hysterectomy, robotic hysterectomy, which is this. It goes a little. They said it's less invasive than the regular hysterectomy." Then from there, she said, "Oh, we're just gonna remove your uterus and leave everything else," because she doesn't want to pull me into full menopause. I said, "Full menopause, lady, I'm already sweating. I'm already having the whole entire menopause situation going on. What do I care about going into full menopause? It is what it is. If it's going to save my life, it's going to save me. Do whatever you have to do to make sure that I do not become one of the people that have ovarian cancer." So she didn't want to take my ovaries out. So I went and got a second opinion from another doctor. That's another thing too. Make sure you get a second opinion from anybody else. If you don't agree with what your doctor is telling you, go see someone else. And make sure that they listen to you. Because again, they don't listen. They look at your age and they be like, "Oh, you're too young for all of that stuff. Oh, it's nothing." Some doctors, this doctor told me that, "Oh, don't worry about it. Oh, it is nothing. It is what it is." Then when I explained to her about what was going on with my mom and what happened to my mom and all the stuff that I went through with my mom, as they were telling her it was menopause, it was telling her that she had some stomach virus, it was telling her that it's just they couldn't find what was wrong with her. They even told her that she did not have cancer. Can you believe that? One hospital told her that she did not have cancer. Mind you, I was with her the day before at a baseball game with our kid, with her grandson and my brother, and she was fine the day before. Then I saw her the next following day. She looked like she was 9 months pregnant. What happened? And then I take her to the hospital, and they tell me it's just water weight. Water weight? How do you just gain water weight just like that? Whatever. Anyway, so as I was saying, all the stuff that was happening, um, to me, everything has been deja vu. Everything as I went through with my mom, it seemed like it was happening to me. I don't know whether it was my mind is playing mental tricks on me or what. But again, if it's not playing mental tricks on me, I need to know now before it's too late. So, because I got a lot of life to give, I still got to bother a bunch of people. So, again, regress. So, as you can see, now I'm getting ready to schedule for a hysterectomy. The second doctor, I explained to him what was going on. He basically told me, he goes, well, if your mom passed away from ovarian cancer at the age of 49, it's not draw of the luck that she just got ovarian cancer. It is genetic. So basically what you mean it is genetic, it means that someone in my family already had it. Whether it was, I know it wasn't my grandmother, because my grandmother passed away at 106 years old. 103, sorry, 103. I don't know who it was. Maybe my grandfather had cancer. I don't know, because I never met him, and he died when my mother was younger. So again, she never really talked about it. Back in the days, people never talked about a lot of stuff. A lot of the health issues, they didn't talk about it. We don't know. So a lot of my health information is very limited to what we see and what we observed on our own. So again, the doctor told me that no, you need your ovaries removed as well, to make sure and to prevent you from actually having that gene in you, to get it removed. So when I went back to my doctor that I'm supposed to be having the surgery with, I told her, I says, look at the chart. And then she goes, oh, well, I guess we can do it then. You know what? You're right. I guess so. I'm like, really? I said, it takes someone else to tell you something that you should already know. Okay, I got it. Don't worry about it. As long, again, be your own advocate. Advocate for yourself. Don't make them listen. Don't listen. Don't listen. So, here it is. Today is November 26th. It's November. Goodness gracious. Oh my God. Look what month I'm in. I'm in February. Sorry. Today's February 26th. Tomorrow, February 27th, at 8:30 a.m., I will be having a full robotic hysterectomy, meaning that they're going to be taking out my uterus. They take out my fallopian tubes, as well as my ovaries. From what I understand, they're going to inflate me in my stomach, and have some robot go inside and start cutting and snipping and whatever it is. The procedure lasts at least about 2.5 hours long, so I'm going to be under for a while. Recovery is between an hour to 2 hours or so. So in order for me to prepare myself for this hysterectomy, I started doing a lot of research. From what I saw, so many people were not even talking about hysterectomies and what it's like and how you feel. My mind is all over the place. My mind is I don't know. It's up and down. It's a roller coaster right now. I can't focus. I'm just beyond on expectations on. Some people is like, oh, don't worry about it. You'll be fine. Some people are like, no, it depends on your body. Some people be like, oh, you'll be out for 6 weeks. You'll be out for 3 weeks. You'll be out for 2 weeks. Oh, some people are like, oh, I was up and walking around by a week. Okay, that's fine. That's you, that's them. Maybe I'm different. Maybe I'm the same. Who knows? So I'm going to show you guys what I'm doing now to prepare myself for tomorrow morning. So what I did after I come home, this is a heating pad that I bought. I bought me some postpartum recovery support things for my stomach. Because I guess, they said it's supposed to increase largely. And I worked out a lot. So I don't want to get that back. So therefore, I'm going to be utilizing this. Then also, I've got me some air compression leg massages. Because again, I'm going to be laying down too. So when you're laying down, the muscles and the blood is not going to be circulating properly. So I want to make sure that that's circulating properly, and I'm good to go. Then I also, from what I understand, because of the air in my stomach, if I'm laying down flat, it's gonna it would go a rise to my shoulder blades, and that would give me extreme pain. So what I did, I bought this little cushion thing. So instead of me laying down or watching TV or anything like that, I am here sitting up like this. Then, of course, the worker that I am, constantly, I refuse to stop working. So I'm going to be doing my other stuff that I do, my travel and everything else. I bought me a little table top for my table. And then I also bought a little keyboard and mouse to keep me occupied and whatever. Then I also did some food preparation since, I can't be, up and down walking around so much. So I prepared some food for at least the next 4 days, 4 to 5 days, depending on how fast I eat them. I don't know. I really don't eat that much. So let's see how long it's going to take me. And then lastly, in a little while, I'm going to get pre-prepped and ready to get ready for my surgery. So they gave me my nice little, folder with everything in it. And in this folder, it tells you, prior to that, you're supposed to get your blood work done between 7 to 10 days. I got my blood work done. Everything came back fine. The only thing that's actually a little off is actually my oxygen. So they realized that a lot of the times when I'm sleeping, I guess that's another thing too, I got to get checked for sleep apnea now. Because from what they're saying is that I lose a lot of oxygen when I'm sleeping. And that's not a good thing. So that could also have been the reasons why I've been having all these issues and symptoms too. But I don't know because I never got them tested. And no doctor actually told me to do that either. It took a nurse who called me up and was asking me a whole bunch of 50 million questions to realize to say, hey, do you sleep at night? I'm like, no, I only have 2 hours of sleep every night. Sleep? What is sleep? I'm like, look at my eyes. I'm like, I'm tired all the time. Always tired. Tired, sleepy. But again, I can't sleep. My mind is racing. My mind is going. Maybe that's premenopause, something. I don't know what it is. But again, no one is talking about it. So how can you know what it is? Because no one is telling you. Everybody's keeping it on a hush-hush. This is not a hush-hush. Really is not a hush-hush. What is going on in our women's bodies is not a hush-hush. Other women need to tell other women what's going on, really. And stop sugarcoating it. Just because it's not that light to you or whatever it's soft for you or hard for you, whatever, tell someone. Because maybe somebody else is going through something and they don't know what they're dealing with. And that was me. I didn't know exactly what was going through my mind. My mind is like crazy. What was going through my body? What was everything? So now when somebody starts talking about stuff like that, I go, you know what? Let me tell you what happened with me and what has been happening with me. To give somebody an insight. Because knowledge is power. And if you don't know, you don't know. So, again, back. So now I'm going to tell you now what I'm getting ready to do. In a little while, I will not be able to eat anymore. They said I could still have some light drinks, like maybe some water or anything liquid that is light, clear liquid. No milk, no dairy products, things like that. I cannot have that anymore after 12 midnight today. Because, again, my surgery starts at 8:30. I have to be at the hospital at 6:30. So in a little while, I'm going to go take a shower. I'm going to air dry because it said you're not supposed to use the towel to dry off. So I'm going to air dry, wait half an hour, and then wipe myself down with these cloth tissues that they gave us. Once I do that, I'm going to make sure that my bed is nice and clean. I already have clean sheets on the bed, and I already took out my pajamas to put them over. They said once I finish with this, my body's going to feel sticky. Make sure you don't wash yourself off and just go to bed and just go relax. So I'll be up again at 5 a.m. getting ready to leave my house with my son He's going to be taking me to the surgery process, and then there I'll record again. So, all right, guys. So I just wanted to give you just some little insight of what was going on, what's been going on in my life. I don't really tell anybody, my business, but this time I've been contemplating, and for some reason it's telling me to tell you guys exactly what's been going on in my life. Okay, so tomorrow I'm going to tell you, walk you in as I'm coming into the operating room. Not even I can't go to the operating room with my phone. So before that, I'm just going to talk to you guys, tell you how I'm feeling. Right now I'm extremely nervous, so I'm talking like, really, really fast. Extremely nervous. People say, oh, you shouldn't be nervous, but no. Anything can happen in the operating room. So stay with me, guys. I see you tomorrow. Good night.